I am now going to listen to your lung sounds. I should have kept this on. All right, and whenever I touch my stethoscope to your chest, I just want you to breathe in deep for me, please, and big breath out. All right, in. Okay. All right, I'm gonna go here. Deep breath. Deep breath for me, please. And one more. All right, and breath sounds are clear and there are no adventitious lung sounds noted. I am now going to listen to the back now. And move your braids. All right, and same thing when I touch my stethoscope, just give a big breath in for me, please. All right. Deep breath. Deep breath. All right, and deep breath. And one more deep breath. All right, and again, breath sounds are clear and there's no adventitious lung sounds present, and they're equal bilaterally. I'm now going to assess the abdomen and ask you a couple questions. Have you had any changes in urination?
No.
Or appetite?
No.
When was your last bowel movement?
This morning.
This morning. And are you experiencing any pain?
No.
All right. So I'm noting that the skin color is uniform and consistent with the rest of the body. The texture appears smooth. I'm noting no redness or edema. And I also noted no redness or edema in your on your chest as well. So I'm going to listen to your bowel sounds now, and I'm going to listen in all 4 quadrants. I'm going to start in your right lower quadrant. All right, and bowel sounds are normal active. I am now going to palpate in all 4 quadrants to check for any nodules or masses. Okay, and there are no nodules or masses noted. I'm now going to assess your upper extremities. Before I do that, are you experiencing any changes in sensation, like any numbness or tingling?
No.
Any weakness? Any changes to your range of motion?
No.
And any pain?
No.
No? Okay. So I'm going to start by just kind of palpating. I'm going to work my way down from your shoulders down to your hands. All right, and I am noting that there is firmness, no hardness or bulging, so that's good. The skin is intact and it is uniform in color and consistent with the rest of your body. I am now going to have you squeeze my fingers. All right, now if you could pull them. All right, and now push on my hands. All right, so muscle strength is a 5 and it is equal bilaterally. I'm going to now check for capillary refill in your fingers. All right. And capillary refill is less than 3 seconds. I'm now going to check your brachial pulses and your radial pulses in both arms. All right. Brachial pulses are graded out of 2 and they're regular in rate and rhythm. I'm now going to check your radial pulses. And radial pulses as well are graded at a 2 and they are equal in rate and rhythm bilaterally. I'm noting no redness or edema, and I will now move on to the lower extremities. Before I assess the lower extremities, I'm going to ask, are you experiencing any pain?
No.
Any changes in sensation, numbness, or tingling? Any weakness?
No.
Any changes in range of motion?
No.
No? All right. And I'm going to palpate your legs again. So if you could uncross your legs for me, please. Sorry. All right. All right, and I'm noting no edema or redness. I also am noting that there is firmness in muscle. However, there's no hardness or bulging, which is good. The skin on your legs is intact. It is uniform in color. It is consistent with the rest of your body. I'm noting no lesions, and I am going to check your posterior tibialis pulses and then your pedal pulses as well. All right, and pulses are graded at a 2 and they're equal bilaterally and they are regular in rate and rhythm. I'm going to check your pedal pulse now on both legs or both hip feet. All right, and pedal pulses are graded at a 2 as well, and they're regular in rate and rhythm and they're equal bilaterally. I'm now going to check for your capillary refill in your toes. I'm doing one at a time. All right, and capillary refill is less than 3 seconds. I'm now going to check, I'm just gonna have you push and then like flex against my hands. So if you can push against me. All right, and now flex. All right, and muscle strength is graded at a 5 and equal bilaterally. So this completes my head to toe assessment. I'm going to put up the guardrail or the rail for safety and put the call bell here. If you need anything, let me know. Upon assessment, the skin is all intact and uniform in color. There are no abnormalities in the musculoskeletal system or the neuro system, no numbness or tingling noted.